Good afternoon, everybody, and welcome to today's update on COVID-19 in New Brunswick. Speaking on behalf of the province today are Dr. Jennifer Russell, the province's Chief Medical Officer of Health, and the Honorable Blaine Higgs, Premier of New Brunswick. Bonjour tout le monde, bon après-midi et bienvenue à cette mise à jour sur le COVID-19 au Nouveau-Brunswick. Les porte-paroles aujourd'hui sont la médecin hygiéniste en chef, la Dr. Jennifer Russell, et l'Honorable Blaine Higgs, Premier ministre. Dr. Russell.
Thank you, Bruce. Merci, Bruce. Good afternoon. Bonjour à toutes et à tous. Cette semaine, 3 autres citoyens du Nouveau-Brunswick ayant contracté la COVID-19 sont décédés. Ces décès m'attristent énormément et je suis convaincue que tous les citoyens du Nouveau-Brunswick se joignent à moi aujourd'hui pour offrir leurs plus sincères condoléances aux familles endeuillées. Nous partageons votre perte et sachez que l'ensemble de la population du Nouveau-Brunswick partage votre deuil aujourd'hui. Ces décès démontrent la gravité de cette pandémie et l'importance cruciale pour tous de respecter les consignes et les directives de santé publique. This week, we have seen 3 more New Brunswickers die from the effects of COVID-19. This deeply saddens me, and I am sure that every New Brunswicker will join me today in offering heartfelt and sincere condolences to the bereaved families. Your loss is our loss, and all of New Brunswickers grieve with you today. These deaths underscore the seriousness of this pandemic and the vital urgency for everyone to follow public health guidance and advice. Our situation remains grim with no let-up in rising case counts across the province. There were 200 new cases of COVID-19 reported in New Brunswick between December 7th and January 7th. There were 100 cases reported in 27 days, followed by 100 cases in just 4. That's an increase in terms of doubling time that we're not comfortable with at this moment. As of today, 2,161 New Brunswickers are in self-isolation. So they have 14 days ahead of them where they are waiting to see if they develop symptoms of COVID-19. And they will be getting tested on day 10 of their self-isolation. Une équipe provinciale de gestion rapide des éclosions a été envoyée aux résidences Jodin à Edmundston, un foyer de soins de 159 résidents qui compte 221 employés. Des tests de dépistage en masse sont effectués à l'établissement aujourd'hui. En pourtant, la situation que nous vivons au Nouveau-Brunswick n'est rien en comparaison aux éclosions présentement en cours juste de l'autre côté de nos frontières nord et ouest. À l'heure actuelle, il y a plus de 100 000 cas actifs de COVID-19 au Maine et l'État compte plus de 450 décès attribuables au virus jusqu'à présent. Washington and Aroostook counties, our nearest neighbors to the west, have over 1,000 active cases and are adding to this total at a rate of 100 per day. Quebec is averaging more than 2,500 new cases per day and has experienced 8,700 deaths due to COVID-19. Our neighbors' houses are on fire, and the hot embers are flying onto our roof. If we don't take necessary actions to keep this fire at bay, it will engulf us as well. But please let me say that most of New Brunswickers are doing the right things. Most of New Brunswickers are following public health guidelines. But the problem with this virus is that it only takes a few small number of people to contribute to outbreaks that lead to entire zones going to orange and the entire province going to orange. So that's why we all have to take the steps to protect ourselves and our communities. Today, there are 23 new confirmed cases of COVID-19 in New Brunswick. The new cases are as follows. In Zone 1, which is Moncton and southeastern New Brunswick, 7 new cases. In Zone 2, which is the St. John, Kings, and Charlotte counties, 2 new cases. In Zone 3, which is Fredericton and the St. John River Valley, 4 new cases. In Zone 4, which is the Edmundston Grand Falls region, 5 new cases. In Zone 5, which is the Campbellton Restigouche area, 4 new cases. In Zone 6, which is Bathurst and the Acadian Peninsula, there is 1 new case. There are now 246 active cases of COVID-19 in the province. 3 New Brunswickers are currently hospitalized due to COVID-19. I ask you again to keep everyone and those people in your lives that have been affected by this disease in your thoughts and prayers. Aujourd'hui, j'annonce qu'il y a 23 nouveaux cas confirmés de COVID-19 au Nouveau-Brunswick. Les nouveaux cas se répartissent comme suit. Il y a 7 nouveaux cas dans la zone 1, soit les régions de Moncton et du sud-est du Nouveau-Brunswick. Dans la zone 2, qui comprend les comtés de Saint John, de Kings et de Charlotte, il y a 2 nouveaux cas. Dans la zone 3, soit la région de Fredericton et de la vallée de la rivière Saint-Jean, il y a 4 nouveaux cas. Il y a 5 nouveaux cas dans la zone 4, soit la région de Edmundston et de Grand-Sault. Il y a 4 nouveaux cas dans la zone 5, soit la région de Campbellton-Restigouche. Il y a un nouveau cas dans la zone 6, soit la région de Bathurst et de la péninsule acadienne. Il y a présentement 246 cas actifs de COVID-19 dans la province. À l'heure actuelle, 3 citoyens du Nouveau-Brunswick sont hospitalisés après avoir contracté la COVID-19. Je vous demande à nouveau de garder dans vos pensées et vos prières toutes les personnes dont la vie a été touchée par cette maladie. You may recall that in the early days of the pandemic, the government released modeling that attempted to show how COVID-19 might impact our province. The models projected that New Brunswick could see up to 5,600 COVID-19 deaths over the course of the pandemic. Even with stringent public health measures, the best-case scenario was for 550 deaths. Thankfully, we have experienced only a fraction of that loss to date, thanks to the efforts that all New Brunswickers have made to control the spread of the virus. The province of Quebec is currently averaging more than 2,500 new cases of COVID-19 each day. But if they were reporting at the same rate of infection that is now being seen in New Brunswick, they would have approximately only 250 cases a day. Make no mistake, 12 lives lost to COVID-19 is 12 lives too many. But we can take some solace from the success we have had in limiting the number of deaths and severe illness during this pandemic. And I am very proud of all New Brunswickers who have been doing so much hard work to keep those numbers as low as possible. Le Québec signale présentement plus de 3 000 nouveaux cas de COVID-19 en moyenne chaque jour. Cependant, si cette province avait le même taux d'infection que nous avons présentement au Nouveau-Brunswick, il n'y aura que 250 nouveaux cas par jour au Québec. Il ne fait cependant aucun doute. 12 décès attribuables à la COVID-19, ce sont 12 décès de trop. Toutefois, nous pouvons trouver un peu de réconfort dans la façon dont nous avons réussi à limiter le nombre de décès et de maladies graves attribuables à cette pandémie. Et je suis tellement fière de tous les efforts des Néo-Brunswickois et des Néo-Brunswickoises en leurs efforts pour aider à maintenir les nombres de cas dans une façon très basse. However, we are not out of the woods by any stretch. While the dire projections made last spring have not yet come to pass, we may yet experience a surge in hospitalizations and deaths as we are now seeing new cases. Because we have over 200 active cases, we do expect that some of those people will become hospitalized. But to keep this from happening and to keep new cases from spreading, we all must take simple actions to prevent the spread of the COVID-19 virus, such as wearing a mask, maintaining physical distance, sanitizing your hands, and reducing the number of close contacts. And let me be clear that in the orange phase, your household are your close contacts, because those are the people that you were spending time with without wearing your mask. If you are outside your household and you're not with the support person who's attributed to your household, you must wear your mask at all times. Any of the transmission that we're seeing in workplace environments or any social settings outside, which shouldn't really be happening, is as a result of people being less than 6 feet apart without wearing a mask for more than 15 minutes. These actions, keeping your mask on, keeping your distance more than 6 feet, will protect your families, as well as your healthcare workers and our most vulnerable citizens, as well as our economy. These are life and death choices, They affect people's lives and they affect people's livelihoods. We are continuing to address the spread of infection in nursing homes in several communities across New Brunswick. Our public health teams are also conducting follow-up swabbing for tests at Fundy Royal Manor in Hillsborough as well as the Tobique First Nation. And I want to thank these teams for their rapid response to these outbreaks. Au cours des prochains jours, nous redoublerons d'ardeur pour immuniser les résidents des établissements de soins de longue durée, y compris ceux où il y a présentement des éclosions. Nous sommes maintenant mieux placés pour administrer des vaccins dans l'ensemble de la province, car nous avons accès à davantage de vaccins et nous avons réussi à accroître notre capacité à stocker et administrer ces vaccins fragiles. We will be moving forward in the coming days to accelerate our efforts to vaccinate residents of long-term care homes, including those facilities where outbreaks are now underway. Keep in mind, though, that the vaccination, that first dose, takes 14 days to really have a protective effect. So there are people who have been vaccinated within the last 7 days, but the outbreaks in some of those places took place during that time frame, so the full protection is not there yet. But again, our goal is to continue with this process. We are now better able to provide vaccines across the province as the supply increases and as our ability to store and distribute these fragile vaccines improves for the high-risk populations that we have designated. So starting on Friday, we will be conducting vaccine clinics at long-term care facilities in Zone 2, including those operated by Shanix. In the facilities with active outbreaks, our priority must be on limiting the further spread of the virus. We must be certain that any COVID-like symptoms that emerge are actual infections rather than side effects to the vaccine. In highly impacted areas of the facility, we need to focus on critical infection control measures, outbreak control, and avoid confusing vaccine reactions with true infection. It is also not recommended that patients with active infection be vaccinated. As a result, there may be some sections of facilities where there will be a delay in getting vaccine. And again, I have received numerous emails, I know many of my colleagues have as well, around vaccination of all populations, including people in long-term care facilities, including people in long-term care facilities with outbreaks. Staff from the assisted residential facility and unaffected nursing home units can sign up for clinics managed by Horizon Health Network as long as they have had no contact with the COVID-infected areas in the last 14 days. And again, I know there is disappointment out there. I know there are people who wish they were higher up on the list and that they didn't have to wait. I hear these complaints and concerns expressed every single day. We talk a lot about numbers at these briefings, but at its heart, our efforts to slow the spread of the COVID-19 pandemic are not about numbers. They're about people. Parce que le Nouveau-Brunswick est une petite province, cette pandémie prend une forme familière, un voisin, un membre de la famille, un ami, un collègue ou un camarade de classe qui nous connaissons bien. Nous avons connu du succès ensemble parce que nous nous protégeons et nous nous appuyons les uns les autres. Nous devons continuer dans cette voie. La dernière étape de notre cheminement au sein de cette pandémie sera la plus difficile. Les défis à venir seront plus difficiles à relever de tous ceux auxquels nous avons dû faire face jusqu'à présent. Nous devons redoubler d'ardeur et renouveler notre engagement à respecter les directives et les consignes de la santé publique. We cannot let up our efforts until the majority of New Brunswickers are vaccinated against the virus. Now is not the time to become complacent. We have worked so hard as a province to get where we are. We do have more work ahead of us, so we must stay the course. Please get the COVID-19 Alert app, and if you are notified of being positive, use the app to enter your one-time number. It is an anonymous way to do your part in protecting your fellow New Brunswickers by notifying others who may be close contacts. Please stay home and get tested, even if you have mild symptoms, even if it is inconvenient. We do appreciate the efforts that people are taking to make sure that they follow these directions. Please avoid travel. Please self-isolate at a location away from your household if you have that option. Please disinfect surfaces. Please disinfect your hands with hand sanitizer. Please be kind and be patient. Be patient with this process of the vaccine rollout. It will take time. You will eventually get your vaccine. Please be patient with contact tracers. Please give a shout out to all the people you know who are working on the front lines trying to contain the virus. We will get there together. Thank you very much. Merci.
Good afternoon. Bonjour. This week we learned the sad news that 3 more people in our province have passed away as a result of COVID-19. On behalf of all New Brunswickers, Marcia and I offer our sincere condolences to the families and friends of these individuals. COVID-19 has been the cause of 12 deaths in our province since the pandemic began. Every single person who dies because of this virus is a tragedy. And what is worse is that each one is avoidable. These individuals had their lives cut short. They lost out on precious time they could have spent with their loved ones. C'est pourquoi nous devrons prendre la situation actuelle au sérieux. Nous devrons faire tout ce que nous pouvons pour protéger les gens de Nouveau-Brunswick, en particulier nos résidents les plus vulnérables. For now, our entire province remains in the orange level with heightened restrictions. And yet we still don't see the compliance we need to, nor are we making the progress that we need. We have had 260 new cases since New Year's Day, and we're at the highest case count to date, more than double our previous highest number. This should serve indeed as a wake-up call for all New Brunswickers. Some people have been asking whether the province needs to move back to red to turn things around. Et ce moment, la situation est préoccupante, mais elle demeure contenue. For now, we are in orange. But if we were to see out-of-control community spread, if our hospitals were to start becoming overwhelmed, if public health measures were no longer having an effect, or if outbreaks were unable to be controlled through testing, tracing, and self-isolation, moving to the red level is indeed a possibility. But this is an option of last resort. If we did so, it would mean moving K-12 schools to virtual learning only. We would need to shut down many businesses. The potential impact on the Brunswickers' mental health and on our economy would be severe. I know many businesses are feeling the strain, and most, I say most, but not all, are complying with their operational plans. We are unfortunately still finding non-compliance. Earlier this week, inspectors visited 172 sites. The good news is that the majority of these sites were fully compliant, and 99.4% of all patrons were wearing masks. There were, however, some causes for concern. Only 88.9% of employees were wearing masks. 2 employees in 1 retail business were determined not to wear a mask, and each of them received a ticket. Inspectors found that 2 businesses were not following their COVID-19 operational plan as required, and another 14 had operational plans that were not adequate. They also found that 23 businesses, more than 13%, at this time, many, many months after the beginning of this pandemic, they had no plan at all. Nearly 10 months into a state of emergency, that is simply not acceptable. Les inspecteurs et les agents de la PA ont traité la plupart, et ce cas en donnant les renseignements appropriés aux entreprises. 2 entreprises sont reçues l'ordre de cesser leur activité, et 9 autres ont reçu des directives écrites pour se conformer immédiatement aux règles. The time for informing and educating businesses that they need to have an operational plan has come to an end. Going forward, when inspectors and officers find businesses with inadequate plans or with no plan at all, they will be issuing fines or shut them down. Businesses that fail to follow the rules will be subjected to up to $10,000 of fines. Les entreprises doivent avoir un plan opérationnel. et elles doivent respecter ce plan de manière stricte. Ce n'est pas facultatif. Chaque entreprise doit le faire pour protéger ses employés et ses clients. I know it may not feel like it right now, but this is not going to last forever. We have been administered vaccines to priority groups identified in our vaccine plan as quickly as possible and as vaccines are available. We are now posting information on our vaccination efforts through the COVID-19 dashboard. You can check the dashboard for weekly updates on the number of doses of vaccines we have received, the number that have been administered, the number held to serve as a second dose, and the number of people fully vaccinated. À mesure que le nombre de vaccins augmente, nous pourrons avoir des données plus précises. Cela permettra au public de voir clairement les progrès que nous réalisons. Et tous les gens pourront voir où elles se situent dans le plan. This morning, a shipment of 2,700 doses of Moderna vaccine arrived in the province, which will be used to vaccinate residents and staff of long-term care facilities. This week, we also received 3,900 additional doses of Pfizer-BioNTech vaccine. Several clinics are taking place over the coming days for healthcare workers and long-term care workers in direct patient care, including but not limited to physicians, nurses, and LPNs. This week, we will administer 975 doses in St. John, 975 in Fredericton, 488 in Campbellton, and 488 in Edmundston. A 3-day clinic also started today in Moncton to deliver a second dose to 1,034 healthcare workers. We do not have any doses that are unspoken for. The only vaccine sitting in freezers has been set aside to ensure everyone who has had their first dose is able to receive their second in a timely manner. Now more than ever, it's clear that COVID-19 is all around us. And as you heard Dr. Russell talk about our communities to the north and to the west, just today, Maine reported 808 new cases and 8 more deaths. There have been more than 32,000 cases reported in the state since last March. And right now in Aroostook County, 746 active cases. I want to remind everyone who has been outside of the province and returned to New Brunswick, they must complete a 14-day self-isolation. Some people are clearly not following what is required. We have had reports of a large birthday party, which as many as 40 people, that sparked a number of positive cases. In other cases, people have attended family dinners, even though they had COVID-19 symptoms. We've heard that a card game resulted in a number of cases, far beyond those who attended the actual get-together. There are other stories that we've heard about reckless behavior. One situation where an individual goes to a paint store and tells the salesperson, I needed to get some paint. I'm home in self-isolation and I need something to do. It's not out shopping for paint or shopping for anything else that individual should be doing. They could paint in their house, but someone else should do the shopping for them. These are what seem like innocent acts that can cause the virus to continue to spread. We must each have behavior conducive to following public health rules. L'auto-isolement ne permet pas aux gens de sortir pour aller marcher dans leur quartier ou pour aller se chercher un café en service au volant. L'auto-isolement veut dire que vous devrez rester à l'intérieur et être complètement séparés des autres. Vous devrez prendre des dispositions pour faire livrer de la nourriture et d'autres produits nécessaires. You are not permitted to leave your property for any reason other than a medical emergency. You cannot have any visitors, and you must avoid contact with anyone else in the household. That means eating and sleeping separately and maintain at least 2 meters of physical distance at all times. Certaines personnes ne respectent pas ces mesures. Parce que je sais que la plupart des gens de New Brunswick respectent les règles. Malheureusement, 70% seront tout de même exposés au virus, sans la moindre faute de leur part. Telling the truth about the places you've been and the people you've spent time with is the only way contact tracers can do their job properly. It's the only way we can make sure we contain the virus once again and get the whole province back to the yellow level. La dernière semaine n'a pas été facile. Je veux dire merci aux personnes qui font la recherche des contacts, aux travailleurs de la santé et au personnel des établissements de soins de longue durée. Merci de travailler très fort pour nous aider à maîtriser la situation. Nous avons aussi connu l'augmentation du nombre de cas dans les écoles récemment. Je veux dire merci au personnel enseignant et à toutes les personnes des écoles de Nouveau-Brunswick pour leur patience et leur travail acharné durant cette période difficile. Although we have seen cases in people who attend or work in school, we have not seen the virus spread widely within the school system, which means the system is currently working. We are certainly facing a setback at this time. We do have schools that are impacted, but we must together get back on track. We must follow the rules. We must just take the extra steps necessary to get this back under control before it's too late, as we've seen in other parts of the country. Let's all do our part to get New Brunswick back to yellow as soon as possible. Let's look forward to the vaccinations. Next summer at this time, let's say we survive COVID. Let's say we have a province that is moving forward once again normally. Thank you. Merci.
Thank you, Premier and Dr. Russell. Merci beaucoup, Monsieur le Premier ministre et Dr. Russell. Nous allons maintenant procéder aux questions des journalistes. Vous avez le droit de poser vos questions dans la langue de votre choix. We'll now proceed with questions from members of the media. You have the right to pose your question in the language of your choice. Each reporter will have one question. Chaque journaliste aura une question. Voulez-vous assurer de désactiver le son de vos micros? Please ensure your microphones are placed on mute. Laura Lyle, CTV.
Thank you, Bruce. This question would be for Dr. Russell. Dr. Russell, there is a sense of urgency, especially for families at Parkland St. John when it comes to vaccinations. What is the timeline for residents and staff there to be vaccinated, and how many vaccinations are being directed there, and to any other long-term care homes in the St. John region?
So I do understand that sense of urgency that people are feeling. I do have those emails in my inbox, so I'm hearing from people who have those concerns. And up until now, the vaccine manufacturers had advised against administering the vaccine to anyone currently experiencing who had COVID-19 at the time. And in a communal setting during an outbreak, all residents really need to be considered and treated as if they are positive cases. So that's why everybody's self-isolating due to the incubation period of the virus. So we were doing the several times a week testing of all of the residents and all of the staff, even though we know that it's a snapshot in time and it's not really going to tell us that it's not going to guarantee that someone will not develop the symptoms of COVID-19 since the time the test was administered. So even after receiving the vaccine, the individuals can still potentially become infected and spread the virus. And that first dose of the vaccine really takes 14 weeks to take effect in terms of immunity. And it really takes that second dose, whether it's 21 or 28 days after that, to really get full immunity. And even then, you need another 7 to 14 days after that to really reach the best immunity level possible. But even with the best immunity possible, it means that the person who received the vaccine is the person who is protected from serious symptoms but it doesn't necessarily protect others around them in terms of getting infected and shedding the virus. So the reason for not vaccinating in Parkland St. John, we did investigate whether the vaccine can be safely administered in a situation of an outbreak. And it does require work. So I think that's the part that people might not quite understand, is that it is really, it takes a lot of effort to ensure proper infection and prevention control. And we really needed to dedicate our time and effort and resources towards that. That was going to be the most protective thing at that time. We are now able to move forward with with vaccinating residents in the facilities with an ongoing outbreak, with the exception of the most affected units. But again, I just want everybody to have patience and understanding that it is very complex dealing with all of these situations concurrently. So we do really ask that people have patience at this time. All long-term care facilities will be prioritized based on a risk assessment that includes whether they're in an active outbreak or a prior outbreak against vaccine supply at any given time. And there are 8 long-term care homes in Zone 2 that will be vaccinated. And then in terms of the doses, we've got 2,700 doses of Moderna arriving in the province today, and all of the Moderna vaccine will be going to vaccinate residents and staff of long-term care facilities. We have an additional 3,900 additional doses of Pfizer-BioNTech vaccine, and that's going to be received this week. And a number of clinics are going to be taking place over the coming days for healthcare workers. So again, this is a drop in the bucket in terms of the entire population of New Brunswick, but just know that that 12-week rollout phase for the first doses of the vaccine are prioritized for long-term care facility residents, healthcare workers who have direct contact with COVID patients, First Nations adults, and also people 85 and over. So whether you're at the beginning of that rollout in the first week or 2, or whether you're in the 12th week, that priority group will be done over the course of the next 12 weeks.
Thank you, Doctor. Thank you, Ms. Lyle. Vicky Hogarth, CHCO TV.
Thank you, Bruce. Dr. Russell, if a vaccine is 95% effective, does that mean some people may still experience mild symptoms if they come in contact with the virus, or does it mean that the vaccine doesn't work on 1 out of 20 people? What exactly does it mean, and how long do we currently think immunity the vaccine provides lasts?
So there are many unknowns, Vicky, at this time. And so the efficacy right now in terms of protecting individuals, we know that people can still get COVID-19 with having been vaccinated. We know that if they get the COVID-19 infection, they can possibly spread it to others. So that is why we can't take any chances at this moment in time around continuing with our public health measures, probably right through until September, when the majority of New Brunswickers will be vaccinated. So again, between now and then, I know we will be learning a lot in terms of data, because right now we only have immunity data for probably about 60 days post-vaccination after that second booster. So, so there's going to be a lot more information that will be following at this time.
Thank you, Ms. Hogarth. Thank you, Dr. Mathieu Roy-Comont, l'Acadie Nouvelle.
Bonjour, ma question est pour le Premier ministre. Monsieur Higgs, Maritime Bus a annoncé aujourd'hui qu'il reportait de 2 semaines la fin des trajets vers le nord parce que le propriétaire est encouragé par les négociations, les discussions qui seront avec les municipalités. Les municipalités disent qu'ils ne pourront pas sauver le système sans la contribution de la province. Est-ce qu'il y a une possibilité que la province investisse de son argent dans Maritime Bus?
Mathieu, je m'excuse, Monsieur Roy, peux-tu répéter votre question, s'il vous plaît? On a un problème d'audio, mais je pense que c'est tout réglé. Peux-tu répéter?
Oui, pas de problème. Monsieur le Premier ministre, Maritime Bus a annoncé aujourd'hui qu'elle reportait de 2 semaines la fin de ses trajets vers le nord et des trajets directs entre Moncton et Fredericton, parce que le propriétaire est encouragé par les discussions qu'il a avec les municipalités. Toutefois, les municipalités disent qu'elles ne pourront pas sauver le système toutes seules et que la province devrait, à leur avis, aussi investir pour aider Maritime Bus durant la pandémie. Est-ce qu'il y a toujours une possibilité, est-ce qu'il y a une possibilité que la province contribuent financièrement à Maritime Bus d'ici la fin de la pandémie?
Yes, it is possible. We are encouraged by the municipalities getting together because the restart money that the federal government had moved to municipalities, it is for COVID-related expenses, and this is confirmed as a COVID-related expense, which I think is always the kind of the criteria that we're looking for, is real, as is every activity that we've seen around people moving around on mass transit. So I'm encouraged to understand what the municipalities are agreeing to, and then how we can move forward in this file.
Merci, Monsieur le Premier ministre. Merci, Monsieur Wacoma. Marie Sutherland, CBC.
Hi, my question's for Dr. Russell. My question's about the significantly larger number of cases we're seeing compared to the rest of the Atlantic provinces in the second wave. And I know you said, I think it was at the last briefing, that this is partly because we're the gatekeeper province that others have to travel through, but we were the gatekeeper in the first wave as well, so I'm wondering, is there something else that's contributing to this wave? And if not, if it is because we're the gatekeepers, isn't that a risk we should be minimizing by further tightening the border?
There are many hypotheses around what's happening with our numbers right now in terms of how everything got started, but the majority of the cases are travel related and they transmitted to their household members as a result of not self-isolating properly. We have had Christmas gatherings as well as New Year's Eve gatherings with people who had attended with symptoms that have contributed to this. We also have people who have attended workplace settings with symptoms. So we know that there was a large drop in testing over the holiday season, and so that has definitely contributed to what's happening right now. So I would say that the biggest issue that we're facing right now are people really not taking into account the major increase in risk that's happened because of all the cases that are increasing in numbers all around us. You know, so we have recently tightened our border control measures because, again, this is a Swiss cheese approach. So we could tighten our borders, we can tighten our testing, we can tighten our restrictions, we can tighten our messaging around staying 6 feet apart and wearing a mask and disinfecting your hands and staying to your one household bubble with your support person. But unfortunately, even since transitioning to the orange phase of recovery, these things are not all working because we're still seeing transmission. So we are at a critical juncture right now, and I don't really know how best to characterize this in any other language other than to say we are at a critical turning point whereby we've gone to the orange phase and we're still seeing transmission after the orange phase directives have been and restrictions have been put in place, which means they're not working entirely. And why is that? So we are examining why aren't they working. And what we're seeing is with the help of our public safety partners, we are seeing that there are businesses that are still don't have, as Premier Higgs said, that still don't have operational plans. We're still seeing complaint-based situations whereby there is a risk in some workplace settings. You know, again, when people have symptoms and don't get tested, that is a risk. When people have had gatherings that really shouldn't have happened in terms of the numbers and the type of setting that it was happening in, again, not great situations. So we do have a collective need right now to really think long and hard about our approach in the sense that we know the majority of the population of New Brunswick has been complying with public health restrictions and measures. And I think that's probably the most frustrating thing for that population right now, that the majority of people who are complying with public health measures and are taking all the steps to protect themselves and their communities. Again, when there's things happening around them that are very clearly going against what public health restrictions and public health measures are trying to achieve, that we can't move together as a province. So we need 100% of the population to move together as a province to address these issues right now of COVID-19, because it only takes 1 or 2 or 3 individuals to start an outbreak in a zone that can then spread to other zones and then lead to a province shutdown. So unfortunately, the odds are not great in terms of, you know, yes, you can have 95 or 97% of the population complying, but that 3% can derail us. So I'm urging every single person, 100% of the population, to follow public health guidance, abide by the restrictions. It is the only way that we're going to prevent what we see in other jurisdictions right now. And it can't be more blunt than that. Thank you.
Thank you, Ms. Sutherland. Thank you, Dr. Silas Brown, Global TV.
Hi there. This is for anyone, whoever would like to answer this. Dr. Russell, you did just speak about that it doesn't appear that the restrictions of the orange phase are entirely effective at this point. And just a quick look at the phase triggers, by my count, it appears that likely about 3 are being hit that could lead back to a going back to the red phase, looking at doubling time, vulnerable outbreaks in vulnerable situations, and non-compliance. So I'm curious, has the threshold for the triggers to go back to red been hit? And if not, what are we missing here, and how close really are we?
So Dr. Russell will talk about the triggers in meeting those thresholds, and I guess at this point we're seeing kind of a steady, daily number, which is concerning because we'd like to see it go down, and we're absolutely, hoping that will be the case over the coming days. But what I pointed out earlier were some very flagrant violations of what are known concerns, what are outside of public health rules, and particularly in a zone orange category. And it's like, we're okay, we can do this anyway. So the comments that I made about the enforcement, the findings, ramping it up, I think if we think about, the concerns around Halifax prior to Christmas time and during that phase, there were some very strict measures put in place at that time. We've been very successful here going to zone orange with the contact tracing being very effective. And the caseload dropped within a couple weeks, maybe 3 weeks. And we didn't see the continuation like we're seeing right now. So it is different. And it's different because people are not following the rules. And not following the rules is going to have consequences. So the enforcement, the fines, the shutdowns are going to increase. And this isn't an idle threat or an idle issue that we're just saying that, we just got to be more difficult here with individuals. It's like we've asked people to be part of this solution because it's a must. People are dying otherwise. We're seeing it all around us. So we have an opportunity in New Brunswick to continue the great work that's been done for the past 10 months, or we can lose it all. And we can lose it all from one more birthday party or one more big event that people say, oh, it can't happen to me. Well, that's where we are right now. So when enforcement officers are out there, I don't need to hear any complaints about how they're dressed, but I will be asking them to enforce the rules because we must.
Hi, was that Silas that asked the question? So Silas, we do have our meetings every day, several times a day, to continue to examine the triggers and the patterns of transmission that we're seeing. So we have a beautiful map with all the cases outlined in each and every zone, the connections between each and every one of them, the doubling times, the testing positivity rates. We can tell you which zone needs to get their testing rates up, so we can be confident that we're not missing anyone. So obviously it is heartbreaking to hear that, again, there's just a small percentage of New Brunswick's population that is putting the rest of the population at risk. That is heartbreaking. So I am imploring everybody to really take all the steps they need to help cooperate with public health and get us back on track sooner rather than later. So the triggers are 3 different categories. The first category is the epidemiology category, and that is about doubling time, et cetera. It is about case counts and its transmission type, including community transmission and including vulnerable population settings like nursing homes. We do have 3 cases right now that are still under investigation that we are worried could be community transmission. We're still working on that. And now in the second category of triggers are the public health triggers. So that includes the time that people take to contact trace, test, and self-isolate, and then also whether people are complying with public health measures. So, even if it's just a small percentage, 1% of the population not complying with public health measures is actually a large number in light of the risks of COVID-19 and the exponential growth in cases that we see very rapidly in each zone. So we don't want to continue to see that, obviously. The other one that we follow very closely with the RHAs every single day, we get a capacity picture of, what's the ICU capacity, what's the hospital bed capacity, what's the healthcare worker capacity, what are the admission rates like and discharge rates like. So we have a very specific picture of what the risks are to the healthcare system. Will surgeries need to be postponed? Will certain services not be able to be offered because healthcare workers are self-isolating at home as a result of COVID-19 being a close contact of somebody? And that impact on the capacity of the hospital is looked at also. So yes, we look at those every day. Are we close to going to red in any zones? Well, again, that is a last resort, and anything that we can do to prevent that, we will do.
Thank you, Doctor. Thank you, Premier. Thank you, Mr. Brown. Harry Forrestal, CBC.
Thank you, Bruce. Dr. Russell, this is a question for you. Epidemiologists we've been speaking with make the point that now that we know the delivery dates of vaccine by the federal government, there's no reason to hold those booster shots in reserve in freezers all across the province. On the contrary, given the spread of COVID, it's wiser to vaccinate as many people as possible, as quickly as possible, with the certain knowledge that the federal government has more vaccine on its way to provide for those booster shots. How do you respond to that?
Well, Harry, I can tell you that those discussions have been happening across the country with our counterparts 3 times a week. Many hours have been spent on this topic, as well as with our provincial teams. We've actually done the modeling to show if we did it that way, would we achieve the outcome that we want? And the consensus here in our province, and we're very comfortable with that at this time, is that we are following the guidance that NACI has provided for us. We are sticking with the interval that they are recommending for vaccinating people. We do live in a province where the weather can really get the better of us. So we're trying to be wise with respect to, providing the best benefit for New Brunswickers at the population level, knowing that there is a limited supply. Yes, we are getting more, but again, I think that nobody will fault us for being cautious in the sense that, whether it's 6 weeks, 7 weeks, 8 weeks, I mean, we're talking a difference of, a week or 2. And so I think that based on what we've accomplished so far and the work that we've done collectively so far, and again, it's an evolving situation, and we are very excited to get more doses sooner rather than later. There's nobody happier on this planet about that. But again, we are sticking with the plan that we have rolled out. We've been working on this plan since July, and it continues to be modified because of the new information. And anything that comes out of NACI, we will continue to incorporate into our information and decision making.
Thank you, Doctor. Margot Castada, Aquabari, Radio-Canada.
Oui, cette question est pour le Premier ministre Higgs. Cela concerne les personnes qui mentent ou ne collaborent pas à la santé publique. On dit qu'ils peuvent avoir une amende au-dessus de $292. Mais si une personne avoue honnêtement lors d'un appel de traçage avoir mal respecté les règles, est-ce qu'elles peuvent avoir une amende quand même lorsqu'elles avouent, par exemple, s'être mal isolées?
Short answer would be yes. If we find people not following the rules in any category at this stage, they can be fined. They can be ticketed because we have to have adherence. And the sad point, as Dr. Russell just pointed out, is that the vast majority of people are protecting themselves and others, and it's the flagrant violations that are causing the risk to us all.
See Margot. Rachel Cave, CBC.
Yes, this is for Dr. Russell. Extraordinary news about the vaccination efforts at Parkland St. John. I'm hearing from families who are quite desperate to hear more detail. We assume this is Moderna. I guess Lily Court and Portland Court are excluded. Will people have to show a negative test? What will it take to get into that queue?
Well, I did go through that in detail in one of my other answers. I can just go through the same answer again. Again, it's based on the fact that we weren't planning to vaccinate people in settings where there were outbreaks. However, now that we are, we need to make sure that the work that's already being done in terms of cohorting people and self-isolating people and infection prevention control is done properly. And again, I have received emails in my inbox, so I do know that people are really worried and really concerned and really want the vaccine right now. So we are going to do the vaccination with the exception of the most affected units. And again, I know this is disappointing and frustrating and anxiety provoking. I am aware of that. But again, we will continue to be prioritizing based on risk assessments, whether an area, whether a whole facility or areas of a facility can be vaccinated during the outbreak. So we're going to keep looking at that, but we're trying to do what's safest for those residents at this time. And I do want to acknowledge Harry from CBC had asked really about whether or not we wanted to make any changes around the fact that there are doses in freezers around the province. As I mentioned, we are following the National Advisory Committee on Immunizations guidance, whether to extend that interval or not, and we really reserved any of that approach really from an operational perspective with respect to weather and unforeseen circumstances that way. So again, if we do change anything, we do have the flexibility of changing our approach, but at this point in time, we are really wanting to give the vaccine at a time when it can be the most effective. So again, we're following the guidance of manufacturers and NACI and providing that second dose of the vaccine at 28 days. And again, we did do some modeling to show, okay, what if we gave it all the doses immediately and what that would look like. But again, based on our assessment and our analysis of all of the information around the doses that we will have available, it really wasn't, and Premier Higgs was actually in part of that conversation. So the COVID-19 cabinet is aware of all the information around our prioritization and utilization of the vaccine as those doses come in.
Thank you, Doctor. Thank you, Ms. Paige Woodard, Mayor Michelle Leader.
My question is for Dr. Russell. Can you speak to what you're seeing in Zone 7 in terms of testing rates and why you believe this zone continues to be an outlier with no confirmed active cases?
Well, let's be clear that any zone that has 0 cases is only a reflection of what happened about 7 days prior. So I can tell you that 7 days ago, there was nobody in Zone 7 that was positive for COVID-19. And in terms of the testing parameters that we look at, up until January 11th, we had, between December 11th and January 11th, we had 2 cases that were positive in Region 7. We conducted 1,319 tests, which is a 0.2% positivity rate, and that's 4.15 per 100,000, which is well below the target that we're looking at. So again, COVID can happen anywhere in any zone at any time in the province, and it's really a snapshot of what happened in the 7 days prior. So all I can tell you is that 7 days ago there were no positive cases, but that doesn't mean that tomorrow some couldn't pop up. And again, it would mean that they'd been circulating in terms of being contagious in that area for a few days prior. And it is the lowest testing area of New Brunswick.
Thank you, Doctor. Thank you, Ms. Woodard. Adam Harris, Brunswick News.
Thanks, Bruce. A question for Premier Higgs. Premier, Correctional Services Canada has begun the rollout of vaccinations to high-risk inmates in federal corrections institutions. I wanted your take on that. There's been some criticism of that decision across the country from conservative politicians who believe regular citizens should come first. Others have said it's the humane and the ethical thing to do. I just wanted your thoughts.
Well, it's, I guess I'm not aware of the federal program, and we haven't discussed it as a caucus or a COVID committee, and I'm sure it's something maybe public health have looked at. So I'm not going to weigh in on the federal, what their requirements are. I think that in this process, we've identified the vulnerable groups, and at this stage, that would be whatever category they fit into. But I think we can have that discussion within our team and with public health and see where the provincial position lies.
Thank you, Mr. Gears. Thank you, Premier. Daniel Edwards, Canadian Press.
Hi, yes, I just have a question about the notice of the Dollarama stores that were closed across the province. Is there any information about how the stores were possibly exposed to the virus?
Well, when public health is involved in investigating cases, they deal directly with the organization in terms of talking about risks and how to mitigate those risks. So public health ordered the 9 Dollarama stores to be closed for 48 hours due to a possible workplace exposure to COVID-19. And those Dollarama stores are located between Oromocto and Edmundston. So at this time, it's not believed that there was a risk to the public, but out of an abundance of caution, the stores were ordered to do a deep cleaning before being permitted to open again.
Thank you, Ms. Edwards. Thank you, Dr. Simon Delacre, l'Acadie Nouvelle.
Pour la Dr Rosa, au sujet de la campagne de vaccination et de la stratégie actuelle, je me demandais si les députés, les membres du gouvernement sont inclus parmi les groupes prioritaires et si oui, dans quelle phase de vaccination?
Simon, peux-tu répéter ta question, s'il vous plaît? Oh.
Je voulais savoir si les députés, membres du gouvernement étaient inclus parmi les groupes prioritaires pour la vaccination et si oui, dans quelle phase?
Yes, we've had some discussion about that, and I guess at this stage, we've been taking all the precautions according to public health rules. So I don't see, us being in a priority situation, and I'm certainly not going to place myself in one. So we will follow the protocol as exists today, as outlined and as agreed to by our entire Cabinet and COVID Cabinet Committee. And at this point, no special rules for elected officials.
Merci, M. Delacre. Gilles Duval, TVA.
Oui, bonjour. D'après le début de l'allocution de Dr. Russell cet après-midi, est-ce que ça veut dire qu'on confirme que oui, il y aurait un cas de la COVID-19 à la résidence Jourdain à Edmundston et est-ce qu'on a identifié la source?
Alors, on a envoyé notre équipe. Oui, il y a un cas positif de COVID-19. Alors, notre équipe est rendue là pour faire des dépistages, comme chaque fois qu'il y a un cas à un foyer de soins ou une résidence à long terme. Alors, c'est sous une enquête à ce moment-ci.
Merci, M. Duval. Sophie, des hôtels Radio-Canada.
Oui, bonjour. Ma question est pour le Dr. Russell. Nous sommes le 14 janvier, donc on avait prédit qu'à cause des rassemblements des fêtes, il y aurait probablement des nouveaux cas chaque jour pour les 2 semaines qui suivent la fin de la période des fêtes. La santé publique a accepté qu'il y ait 20 contacts pendant les fêtes. Il y a des gens qui remettent ça en question, qui disent que c'est à cause de ça, c'est trop de cas. Trop de gens qu'on pouvait voir durant cette période-là et que c'est ce qui a causé le nombre de cas importants qu'on a aujourd'hui au Nouveau-Brunswick. Qu'est-ce que vous répondez à ça et comment vous avez fait ce calcul pour permettre des contacts avec 20 personnes?
Alors, vous demandez durant la phase jaune, quand on avait dit que vous pouvez avoir des rassemblements avec un maximum de 20 personnes dans votre qui inclut votre bulle d'un ménage pendant les fêtes.
Oui, comment vous êtes arrivé à ce calcul-là? Parce qu'il y a des gens qui critiquent le fait que c'était trop de monde, trop de personnes, trop de contacts.
Oui, c'est parce qu'il y avait des gens qui ont été à des rassemblements, même plus petits que 20, mais ils étaient là avec des symptômes de COVID-19 parce qu'ils n'ont pas été testés. Alors, si vous participez dans un rassemblement où vous avez des symptômes de COVID-19, c'est dans ce temps-là que ça va être transmis à toutes les gens qui sont à le rassemblement.
Merci, Mademoiselle des Hôtels. Mia Urquhart, CBC.
Thanks, Bruce. My question is for Dr. Russell. Today marks 2 weeks since New Year's get-togethers. Do you think we're going to start seeing a slowdown in the number of cases in the coming days, or is that still a wild card you're concerned about?
So when we saw the Christmas Eve gatherings and the cases associated with that, we knew that, okay, with those close contacts and the transmission we were seeing, it would take at least 2 weeks before we would see the outcome of that. With the New Year's Eve gatherings, we knew again we're going to see another 2 weeks of what that transmission is going to be like. But then we went into the orange phase of recovery all around the province. And so that was supposed to help with, somebody has to mute their mic. Somebody has to mute their mic. S'il vous plaît, mettrez votre micro sur muet. So we haven't seen a plateau yet is the unfortunate part of the story here, which means, and what we've seen and analyzed, is that there is transmission happening after the orange phase restrictions were put in place that really shouldn't be happening if everybody was following the orange phase of recovery guidance and restrictions. So this is the problem. It's only a small percentage of people who are not following the guidance, but the problem with COVID-19 is that's how it exploits those cracks in our compliance. It will take every opportunity to spread, whether we like it or not. So I know nobody means for COVID to spread in their community. Nobody means to bring it to their workplace or a gathering or their household, but it is happening. We expect to continue to see travel-related cases, and we do expect that if we continue to try to mitigate the risks around travel, getting the travel guidance and restrictions as tight as possible, getting self-isolation requirements as tight as possible to protect people and their households, and have people self-isolate separately. That will be something else that we can do to protect ourselves right now. But again, unfortunately, we haven't seen a slowdown. I don't know when we'll see a slowdown. We are having discussions every day about what else we can do to help with the compliance. So that's why we're engaging our partners at Public Safety to help us right now. And as the Premier said, it's not that we're going to be educating people now. It's now that we are taking this as something that is so serious that it's affecting people's lives, it's affecting people's livelihoods. So we can't afford for a small percentage of the population to not comply when most of the population is complying and are doing everything they can to be diligent at this time.
Thank you, Ms. Urquhart. Thank you, Dr. Tom Bateman, Brunswick News.
Good afternoon. For Premier Higgs, please. I just want to ask about mandate letters for your cabinet. I think, we've become used to seeing these letters released publicly from recent federal and provincial governments. And based on an interview with the minister before Christmas, I was expecting to see similar letters for your cabinet. Will this happen? And if not, can you kind of clarify why and perhaps provide your views on the usefulness of these letters being released to the citizens? Thank you.
Well, generally, they weren't very useful at all. They're usually quite generic, and you'd have to read the heading to tell which department it was actually in. So I didn't find them too effective, and so my discussion with department ministers in relation to what we're looking at in each department, is one that we have, routinely, I guess, as part of our caucus and cabinet meetings. And in the case of Mr. Land, yes, we did discuss mandate letters, and certainly he would be familiar with that process as part of a routine. But there's a lot of routine things that I don't necessarily subscribe to, and I guess I'd like to certainly make make good use of our programs. And in the case of Minister Land, the municipal reform and his plan to, he'll be talking more about that going forward. But looking at the plans that we've discussed, and that he's going to be visiting all the communities and has done a lot of that right now already, but certainly not anywhere near what the hopes would be, especially if we can get out of COVID. It'll be self-explanatory of like his mandate and what he's looking at doing, and how we're engaging communities to have more local governance and more autonomy in communities to help progress their future. So, long-winded answer that I haven't seen mandate letters that have been issued from governments very effective.
Thank you, Mr. Bateman. Thank you, Premier. Teresa Blackburn, River Valley Sun.
This question is for Dr. Russell. You and your team visited Woodstock this week. What did you witness related to compliance, and what are the advantages of being on the ground in a community rather than conducting meetings, say, with local leaders by Zoom or other electronic means?
Well, I wasn't really there to observe anything about compliance. I was there for community engagement. Leadership in communities that have outbreaks and are seeing challenges with respect to public health measures being adhered to or understood. That face-to-face interaction is really great for relationship building, and it's really great for, again, showing that we are working as a team. We are working collaboratively and collectively, that there is no stone left unturned in terms of our approaches to try to help communities get through an outbreak in the orange phase without having to go to red. I did just get an email from somebody saying, why aren't we in red? Well, again, red comes with a lot of serious implications. And as we saw with the Zone 5 outbreak several months ago with Camilton and Dalhousie, we did see transmission happening after the orange phase restrictions were in place. We did go up and engage with the community leaders at that time and local media to really help pinpoint and target the areas that needed to improve to get them out of that situation in a timely way, to prevent them from becoming overwhelmed in their community, which then has implications all over the province. So we were there to listen. We wanted to hear the concerns that they were hearing from their citizens, and also to share our messaging with the leaders so they can amplify it and help reinforce it. And I do hope to go to Zone 4 very soon. It could be as early as first thing tomorrow morning, so we are working on planning for that.
Thank you, Ms. Blackburn. Thank you, Dr. Tim Roselle, Global News.
Hi there. My question is for Premier Higgs, and it's more of a follow-up to the earlier question about maritime bus. Just wondering if the Premier could address how and if the provincial government will assist maritime bus in its current situation.
So I don't really have the details of exactly how that's going to happen, but I know the discussions are underway with the municipalities and the joint effort there of identifying the needs and the routes that are important to keep open. And I would guess that'll be resolved sometime, certainly in the next week. And that that we will be able to use, restart funds that are available to communities as part of that initiative, and restoring a service or continuing a service that the municipalities are identifying as certainly needed, not only during COVID, but at this time.
Thank you, Mr. Roselle. Thank you, Premier. Marie-Ève Brassard, Radio-Canada.
C'est Margot Castader, je vais devoir poser la question pour elle. Elle a des soucis de connexion, si vous voulez bien. C'est qu'elle demandait s'il va y avoir ou s'il y a actuellement une opération de dépistage massif dans le coin de Saint-François-Madawaska pour les employés de Nado Pantry et Wesco et les membres de leur famille.
Allô? Alors, j'ai eu des discussions hier avec les médecins hygiénistes qui travaillent dans la région avec l'équipe de santé publique. Alors, l'information que j'ai reçue, c'est qu'il y avait des cas de COVID-19 dans le NADO, la compagnie NADO, et il y aura à avoir des dépistages pour cette compagnie qui va dérouler, je crois que c'est peut-être demain. Alors ça, c'est les informations que j'ai reçues de l'équipe de santé publique. À ce moment-ci, ça, c'est l'information que je peux partager.
Merci. Erica Butler, CHMA.
Hi there, this is for Premier Higgs. We've heard lots of case numbers in communities along New Brunswick borders. We also border with Nova Scotia, where there are currently 32 active cases as of today. In the communities near the Nova Scotia border, it's commonplace to go to Nova Scotia for various healthcare needs, including specialists. And since January 8th, anyone doing that is now required to do something called work isolation, which they can be released from after 2 negative tests. And there's also a new requirement for weekly testing in kids that need to cross the Nova Scotia border for custody arrangements. Also something that's not uncommon around the border communities here. Yet in order to get a test, people in this region need to travel to Moncton. So I'm wondering if you are or will consider increasing access to testing sites in these border communities and or tweaking some of these new border rules as they apply to the Nova Scotia border.
So we have worked with different cases of essential workers traveling back and forth across that border and other borders for that matter. So I think if there are individual cases, they should put in that request so we understand what that looks like and how we can maintain the rules but still provide some coverage there and the testing needed. Because our goal is not to make life impossible for individuals, it's to just find a way to work safely and keep working. So I would encourage them to contact directly through our COVID website, and we'll deal with the individual cases.
Thank you, Ms. Butler. Savannah Odd, Telegraph Journal.
Hi, my question is for Dr. Russell. You've mentioned several times that people are going to work with symptoms, and this has contributed to our current situation. That issue has also been raised by Toronto's Medical Officer of Health. She argues that Ontario should be providing workers with paid sick days because low-income people really can't afford to miss work. Do you recommend New Brunswick provide a certain number of guaranteed paid sick days to curb this trend of people going to work with symptoms? And if you don't recommend this, can you explain why not?
I may let the Premier answer that one, actually.
Savannah, could you repeat your question, please?
Savannah, Ms. Odd, can you repeat your question?
For sure. So Dr. Russell has mentioned several times that people have been going to work with COVID symptoms, and this has contributed to this current situation. And it's an issue Ontario is seeing as well. One of the medical officers of health there has recommended providing people with paid sick days because low-income people can't afford to miss work. Is there any recommendation at this point from public health, I guess, to New Brunswick to provide a certain number of guaranteed sick days? I guess Premier's plan trend of people going to work sick. And if not, I guess, can you explain why you wouldn't pursue that?
So there was actually a program in place, and it was supported federally for additional sick time. So that already exists. So I don't know if and there was a limit on the numbers, so I don't know if we've gone beyond that or not. But I also am aware of cases where someone, has felt symptoms and didn't want to lose a day's work, or they took a day's work off to get tested, and then they lost money. So I mean, there's a balance here that we expect people not to go to work if they have symptoms. We expect people to be fair and honest about the symptoms they have and the need that they need to stay off. So we need to do two things. One, I think they shouldn't lose a day's pay. The other is I think we need to test them promptly so that they're not waiting for tests. So again, as I mentioned earlier about the crossing the border and workers every day, I'd like to know individual cases, individual circumstances, because as Dr. Russell said earlier, we cannot have people going to work with symptoms. That is a problem, and it's critical right now. So if there's an issue there's a particular issue, there's a concern from individuals, we do want to know about it, because we will work with individuals to do the right thing.
Thank you, Premier. Thank you, Ms. Odd. Michael Staples.
Yes, Dr. Russell, I realize you've already answered part of this question already, but how concerned should people be about the temporary closure of the 9 dollar stores in the province, and what advice can you offer people who have visited these locations?
I think if everybody acts as if they have COVID all the time, and if they act as if everybody around them has COVID all the time, they shouldn't be concerned. If you have symptoms, get tested, period. If you go out in public, wear your mask and stay 6 feet away. Disinfect your hands. I mean, these are the things that we have been preaching for months now. And if anybody went to the dollar store and wasn't adhering to those those guiding principles, then, you know, again, I think we all have a responsibility here. Individuals have a responsibility here to protect the larger population, because that's really the only approach that works. That's really the only thing that's going to get us through this. So if you were at the dollar store and you weren't wearing your mask and you didn't disinfect your hands and you didn't stay 6 feet away from people, then yeah, I would be concerned. If you have symptoms, please get tested no matter where you are in the province at any time. Please don't go to work if you have symptoms. Please don't go to school if you have symptoms. Please don't visit anybody, anywhere if you have symptoms. Stay home.
Thank you, Doctor. Thank you, Mr. Staples. Ladies and gentlemen, mesdames et messieurs, voilà la fin de notre mise à jour. Merci beaucoup. That concludes today's update. Thank you very much.